Hello, my name is Nicole Arellano and I'll be doing a video demonstration on pap smear. What is pap smear? Pap smear is a cervical cancer screening test. It can find abnormal cells in the cervix that may, over time, turn into cancer if not treated. What are the recommendations for cervical cancer screening? For women aged 21 to 29 years, the recommendation is to screen for cervical cancer every 3 years with cytology alone. For women aged 30 to 65 years, the recommendation to screen for cervical cancer is either every 3 years with cytology alone or every 5 years with high-risk HPV types testing alone, or every 5 years with both tests at the same time or co-testing. For women younger than 21 years, older than 65 years with adequate prior screening, and women who have had a hysterectomy, it is recommended to not screen for cervical cancer. How is pap smear performed? First, explain the procedure to the patient. Place patient on a dorsal lithotomy position. Observe aseptic technique by putting on gloves. Choose the appropriate speculum for the patient. A water-based lubricating jelly may be applied to reduce friction caused by the speculum. Insert the speculum by placing the transverse diameter of the blades in the anterior-posterior position and guiding the blades through the introitus in a downward motion with the tips pointing toward the rectum. Once the blades are inserted, the speculum should be turned so that the transverse axis of the blades is in the transverse axis of the vagina. The blades should be inserted to their full length and then opened so the position of the cervix may be inspected. Once the cervix is visualized, the speculum is opened and that the introitus is widened. This can be done by using the screw adjustment on the base of the speculum. A single broom-like sampling device is used to collect both populations of cells from the endocervix and the ectocervix. The sampling device should be rotated 360 degrees 5 times. The collected material is then spread onto the slide. The slide is then labeled and sent to the pathology laboratory. That ends my video demonstration on pap smear. Thank you.